Morning and welcome Wakefield to I think our third rendition of our Friday COVID talk. We have Superintendent of Schools on the line with us. We have our Communications Director, Jen McDonald, on the line with us. We have our Rec Director, Dan McGrath, on with us. I see that we have Chair of the Board of Town Council, going back in time, Ann Santos with us. Laurel Gorville is on us from the Board of Health, and Tom Walsh, our Emergency Management Director, is on us, and a number of citizens. Thank you for joining us this morning. I guess I am pleased to report that Wakefield is not a red community for the second week in a row, which is rather important. And can we put up the map first? Kind of give a sense of where we are. Thank you. So unfortunately, the state has changed its procedure. So if you looked on the state's website, as I do, and I know the superintendent does every every Thursday afternoon to see what's happening, the state no longer puts this map up. So I will give credit to WCVB, where I got this from. I guess they do it on their own. But you will note that Wakefield is in the yellow, as is almost every other community around us. Reading, Stoneham, Linfield, Lynn, unfortunately, is still red, and there are some other communities that are red. This is under the state's new metrics, and it kind of shows you really what's going on in our region and what's going on in our area, and what's going on across the state. Can we switch to the actual chart now? So anyways, this is what the, certainly what the state is putting out with us, and it is a chart, and you can get this on mass.gov, and it's really very interesting as it shows every single community in the Commonwealth, and I just have our page there, Wakefield. You can see that Wakefield, over the last 14 days, had 45 reported cases. The case count was 45, I should say, over the last 14 days. We had average incidents per 1,000 of 11.9, which puts us in the yellow. We were in the green last week. We were around 9.1. And we had 3,000 tests taken in the last 14 days in Wakefield, and of those, 53 showed positive results. So that means that we have a positivity rate of 1.75, which is actually one of the lower rates around our community. I went and I looked at all the other surrounding communities there in that same area, but a little bit higher for the most part, although this was a little bit jumped from last year. In talking with Ruth Clay, who's out of town today, and I asked her, specifically, were there any clusters? Were there any things that we could look at there? And these are really no, the answer to that is no. These are really households, individual households. And, one person, maybe one of the parents gets it or a child gets it, and it spreads through the household. One thing that we are seeing, and we need to be very, very careful about, is that, people are getting a little complacent. People are letting their guard down, and, you were always staying maybe in your bubble. Maybe members of your bubble are now, in another bubble, and now you have two bubbles, intermingling, and maybe that's causing a little bit of it. These small groups is what's fueling this throughout the country. So that is something we all need to be very careful about. Wear a mask, stay outdoors, shorten your visits, don't get too close. I know Laurel Gorville's on. Laurel, do you want to jump in here and maybe add any words of wisdom on a health perspective? And you can take the chart down now.
I think, we're seeing and learning exactly what you've just said is sort of this assumption of the bubble. And, it's hitting a little close to home. I now have a sibling who I haven't seen in a month, who is ill. He's managing, but he has high risk people in his bubble. So I was being, fairly stern in reminding people how to isolate within their own house. So even, and this really harkens back to, you know, a century ago when all we had was behavior to manage public health. And so, I think that people need to remember what we learned in March, that we do need to sanitize surfaces. I think within families and family contacts, probably the kitchen and the bathrooms are more suspect. So, I don't have any, I've been following the science on this. No one's really mentioning this anymore. Certainly, we believe this is respiratory. Keeping windows open every so often and following some guidelines. I know that we had some general guidelines as what to do if you were sick in your own home and what isolation means. And I, have sternly reminded people that just because they feel like they're turning the corner, that they still need to stay in their corner per se. So I think, just remembering what that is, and we certainly have some advice on the town website, but I think that's just where we are right now. I think, neighbors, just as you said, Steve, we've been used to kind of getting away with being and chatting. Well, if we're going, if you're going into a house, just keep the mask on. And it's so hard. It's so easy to let your guard down. So just keep it on and be quite careful.
Thank you. Thank you. Tom Walsh, our EMD, anything to add there? You're still not muted, Tom. You're muted. Oh. Now you're frozen. No. There you
Oh,
go.
that's better. Oh, sorry about that. I think that what's happened is people have become complacent, but the problem is that as we can see, that's happened across the country. Cases are rising everywhere. The second surge is definitely in, and I get a situation report in from the state. Yesterday's report showed that we had 175,000 cases in the state so far. Over 10,000 have died. And we still have right now over 26,000 active cases in the state. So we have to really be, vigilant of what we're doing and be diligent about wearing the mask, even outside. There are orders, the governor's orders now. Anybody over the age of 5 has to have a mask on if you're outside. So if people practice these good habits, we'll be able to do it. The same thing with, like Laurel was talking about. I know Thanksgiving's coming up. You got to keep that gathering small, and you have to keep people protected. Majority of the people in the state, over 65% of them, have been elderly, as far as the deaths. But the thing is, as far as in the long-term care facilities. So there is some good news, not for that population-wise, but for the rest of us. But you still have to do the right thing. And if you practice good habits, it's going to go a long way. And for as far as the rest of the town, I think we're still in good shape that way. With protective measures are up, and we're all working together as a great team. Everybody, from the school department, the town hall itself. So everybody is still functioning and doing the right thing. It's just trying to get the public to buy in to make sure they protect themselves.
Thank you, Tom. I'm going to jump to the schools, and then I'm going to jump to the chair of the town council. Doug, anything to add with the schools?
Sure. Good morning. I would like to, thank Steve for hosting this call. I feel like our ability to communicate, we can't communicate enough right now around, this information and the work that we're doing to keep everyone safe, right? And to echo Laurel's words, safety precautions work. They work, and our ability to kind of keep surfaces clean and to kind of continue with hand hygiene and sanitizer is important. But one of the most critical things that we're doing is wearing masks. And so, the wearing of masks not only protects, students, faculty, and staff, it also protects others, right? So it protects individuals, but it also protects others in our school community. And so, and we can't thank our teachers, our nurses, of course, but also an important component here is our parents, right? Parents and guardians. I'm coming to you this morning. I'm joining the call from Woodville Elementary. I can tell you, I've been around the classrooms this morning. Our kids have been amazing with masks. There has not been one student in this school that I have seen without a mask on their face properly, participating in their learning. And so our kids are so resilient and they're just really amazing. So safety precautions work. We can't encourage you enough to continue them. And thank you for your support in that area. In terms of cases, this week, we have 3 new cases that when you add them to the cases that we had on the data dashboard, the 3 new cases, we had 10 as of last week. But the 3 new cases that we're adding would bring our number up to 13. But we did learn that one of our high school students who was deemed positive due to an antigen test had 2 follow-up PCR tests that were negative. So that student was taken out of isolation and improperly coded as positive. So we've corrected the numbers on our sheet for October. And so that should not have been 10, it should have been 9 based on that correction. And with the 3 new cases that we have 1 student at Galvin, 1 student at Walton, and 1 student at Dolbear. And so the total brings us up to 3. We have 8 of our cases, 8 of the 12 students have recovered and are out of isolation and are back to school. They've been cleared by their pediatrician and they are back to school and they are effectively participating in their learning. And so we feel really pleased to welcome those students back. And the fact that we've only had the number of cases that we've had in the school are really due to the safety precautions that we're taking. So we are in touch with our Board of Health, the Department of Elementary and Secondary Education weekly, our Board of Health really daily, and we're watching the data very closely. And we are kind of devising scenario plans in the event that we need to scale back. We're no longer using the term close down because we believe that scaling back will probably be our next position if the virus continues to spread. And we're prepared to do that. I discussed this earlier this week on our faculty call. We have a standing Zoom call with faculty on Tuesday afternoons, and we have a standing call with the community on Wednesday afternoons. And we discussed scaling back this week as well. So in addition to, and I know Brendan Kent can kind of jump in here, we are meeting to think about the possibility. We are meeting the superintendents from the Middlesex League and the athletic directors from the Middlesex League met yesterday to talk about winter schedules. And that also includes extracurricular band and the drama and theater as well. And so there'll be more information forthcoming on that, but I can turn it back over to you, Steve. I don't know if anyone has any questions at this point.
I think I wanted to, again, for members of the public, please use the chat function if you have a question. I wanted to turn it over to the chair of the town council, Ann Santos, for a few words, and then Brendan and Dan McGrath. So Ann, do you have any words to say? Words of wisdom?
My only words of wisdom, which speaking to all the parents of athletes out there, in the hockey people or who I'm talking to, just don't be stupid. I think my sport that I love more than anything has not been the greatest during this pandemic. And as someone who has probably seen her daughter play her last high school game, I didn't know it last spring. She's been playing since 4. I'm heartbroken. I understand that. And this has been a part of our lives for so long. But, you know, those of you who have small children, the loss of this season is not going to impact their NHL career. I say somewhat sarcastically. There's a bigger picture. It is awful that we're doing this. And believe me, on a personal level, I feel it. I'm still wrapping my head around the fact that I will see her on skates in a game situation again, maybe. So we just have to be smart. That the spread among this sport specifically has been a little bit aggressive. So don't try to. All the New England governors have seemed to figure out that crossing the border has caused problems. So they've all banded together. So I would just say, really be smart. Don't try to sneak ice somewhere. And for other sports too. I know how devastating this is. I have a senior captain. she's worked her whole life to this. I think I'm more upset than she is, frankly. But I would just be smart. And again, thank you for the whole team we have in Wakefield, from Brendan to Dan to Doug, you know, Laurel, Jen, Jennifer, and Steve, obviously, and Tom. Just thank you so much. It makes it easier to deal with this emergency.
Well, our heart does go out to Bridget, but it's going to be ruling the world someday. So this is preparing her for it. Great segue. Thank you very much, Ian. That's been an incredible cheer during this tough time. Great segue. We've had a lot of chatter about sports, youth sports, school sports. Thought we'd focus on that a little bit today. Yesterday, the governors of all the New England states came out with a statement that they will no longer have any, and New Jersey as well, they will not have any interstate sport youth hockey events. So this is something that was going on. I think a lot of events were in New Hampshire. We heard about issues happening there as people came back. So, you know, this I think is effective next week. And this is through effective Saturday. Great. Effective Saturday through the end of the year at this point in time. So that and some other updates that came out on youth sports. We thought we would talk about that a little bit today because we're seeing a lot of chatter and a lot of questions out there. So maybe I'll go to you first, Dan, and say a little bit about what we're doing on the town level, and then go to Brendan Kent, who's managing the high school and junior high load.
All right, thanks, Steve. So youth sports-wise, at least in Wakefield, everything's just about wrapped up with the exception of youth soccer. They have 2 weeks remaining. They end on the 21st or 22nd of November. I will say that Wakefield Youth Soccer has been one of the best partners throughout this pandemic. They are light years ahead of probably many other organizations. Sanitation stations, they do it right. They've done it right from the beginning. They ask the right questions. So they'll end with a successful season, which is great that the kids could have some normalcy. We are coming up on basketball season. Basketball is an approved sport right now. They can't even play games. I personally don't know what those guidelines look like yet from the youth level. That's something I'm looking to get my hands on. We at the Civic Center are allowing some youth practices to go on, small groups, less than 10 people total, unless they're splitting the gym into half with the divider down. So those are going on, skills and drills only. I know some of the groups that are renting here were looking to play in tournaments or in leagues in New Hampshire. We're gonna have to talk to those groups and make sure that they know what's going on. We do put on every permit for the field and for the Civic Center that you must know the state guidelines. You must wear masks at all times. As Doug and everybody else has said, the masks are critical. I see it here at the Civic Center where we have the remote school with Wakefield Academy. And, it's sad to see the kids wearing the masks every day, but you know what? They do it without hesitation or without problem. And the real problem is us adults. We got to be the ones to follow the guidelines and set the real rules. And that's just not happening. I do see a lot of people still walking around the lake who don't have their masks on. We need to be better about it. I don't like it as much as the next person, but if it saves, myself, my family, my friends, or the person I'm walking by, that's what I'm going to do. So I think we need to be smart about that, but as a whole, and follow the kids' lead, because they're doing it right. As far as there's other sports going on for the winter, I feel bad for especially our high school kids, especially the seniors. They've lost so much as juniors and now losing even more seniors. Hopefully, we can get some sort of season for them. It doesn't look positive, but hopefully they can have some semblance of a senior year. And, if they don't, let's do it right so the kids in the spring can have something. At this point, it's about getting normalcy back, and we have to do the right steps to have that.
Thank you. Thank you, Dan. Brendan Kent.
Yeah, thanks for having me. Sorry, I was a couple minutes late here, but just a quick update on high school athletics. For those that don't know, we did have 4 sports, 6 sports when you count boys and girls teams this fall. So boys and girls soccer, boys and girls cross country, golf, and field hockey. I have to say, I'm sure there's an outside perspective. I've heard a bit of chatter this week about people being upset with cross-country kids, seeing them not wearing their mask. But I'm here at the school every day, and I have to say, I think that our coaches and our kids have done an excellent job, at least here from what I've seen. We've made it through going on, 8 weeks with our sports programs. And, I wasn't sure when we started if we were going to make it through day one. I think for the most part, our coaches and kids have done a really excellent job. Having said that, going into the winter season, we're going to face significantly greater challenges. So the athletic directors in the Middlesex League have been meeting twice, sometimes 3 times a week. I actually just had a conference call this morning at 9 a.m. And right now we're just trying to wrap our heads around how we can have these winter sports, safely, if they're approved. Last week, the governor came out with his guidance for youth sports. I know a lot of people saw it as a positive. Within the sports kind of athletic director community, I think a lot of people were a little upset. They feel like things might be getting kicked down the road, of people not wanting to be the bad guy to cancel things. The sports that got canceled right off the bat are no wrestling and no cheerleading. The governor's office deemed that those just aren't safe to play at all. And the governor's office EEA really left the door open for all other sports. What's going on right now is every MIAA sports committee is meeting, has met already this week, to come up with quote unquote safe modifications, so that those sports can be played. Once the sport committees come up with the modifications, then it goes to the MIAA board of directors. They look at things. They're also obviously in communication with the EEA. They'll make a decision, and then things will get kicked down to the league and school level. The athletic directors in the league, like I said, we've been meeting multiple times a week. We met with the superintendents in the Middlesex League the other day just to kind of discuss some challenges, what if we do have sports, what they might look like. Again, right now we're still trying to figure things out, how we can possibly make things work safely. The one sport we probably feel most confident about for the wintertime is gymnastics. That's not to say that that's necessarily safe, but that out of all the options, that is probably the safest right now. Indoor track, which obviously everyone on the call is probably familiar. We have a huge track program in Wakefield. We have, over 200 kids in our boys and girls program. We've been very, very successful. We've won 3 state championships in the past 5 years. I don't know how we're going to be able to conduct indoor track. First and foremost, we have all of our meets at BU in Reggie Lewis, which are closed for the winter. So as of right now, there's no facilities to host indoor track meets. Lexington has an indoor track. They've already said that they're not going to be hosting other schools. As far as cramming 200 kids into the field house for a practice, I just don't see how that's going to work. Indoor track, there's huge obstacles to try to figure out how we could possibly do that. I'm not saying no at this point. I just don't, we as athletic directors in the league don't know how we're going to figure this one out. Hockey, as Ann mentioned, we're really reliant on the rinks being available, which I've already had some rink managers call me and say that they're facing their own obstacles. So for example, they usually stack games one after another, 4 o'clock, 6 o'clock, 8 o'clock. They're not going to be able to do that this year because usually the teams that are playing next are already in the locker rooms changing. They're in the hallways warming up. They're not going to be able to allow people in there until the whole rink's cleared out. So right off the bat, they don't know if they're going to have availability, for all of our games or the other team's games. So we're kind of at the mercy of what's happening with the rinks, and if rinks follow the rules and if there's more kind of cancellations coming down. I know that part of the rinks being closed for 2 weeks was because a lot of rink managers were not following the rules, and it was kind of a slap on the wrist to say, hey, let's make sure we're following all the guidelines. So who knows what's going to happen there. Swimming, we had to postpone swimming in the fall because the pools were only allowing certain amount of people. Some pools were only allowing 8 people in the pool area at once, which you can't have a meet or practice if those are the restrictions. So who knows what's going to happen there. Basketball, I'm very curious to see what these quote unquote modifications are going to look like. I see some people chuckling. I don't know how you can safely socially distance, on a basketball court, 10 people, whether it means 4-on-4 zone defense. I don't know. But those are some of the challenges we're facing. I will say, from the athletic director's perspective within the league, one of our concerns is if we don't offer high school sports, that a lot of our kids are going to go off and play club sports, which we're hearing that a lot of club sports that are running right now are not following the rules and regulations, which would put our kids at even higher risk and more danger, and then potentially bringing the virus back to the school. So that's a major concern from our perspective, and one of the reasons why we would love to offer something at the high school level. Right now, we're just really trying to figure out how we can do it safely.
I think an important piece here, just to add to Brendan's comments, this is a similar space. We're in a similar space now that we were in when we started the school year, right? We didn't know if we were going to be able to offer fall athletics, but we approached fall athletics like our reopening plans. Like we should try, right? We should try to do everything we can to try to make the experience of our students the best that it can be, as long as we're doing it safely. And, Brendan's comments are pretty detailed, and I think he's just really scratching the tip of the iceberg, or the beginning of this conversation. Facilities are a challenge for us. The Reggie Lewis in Boston and Boston University's indoor track is closed. That's a challenge. Swimming, there are pools that are closed. And so that's going to be a challenge. There are facilities in the Middlesex League where some of our kind of colleague districts or partner districts are using their gym facilities for classrooms and cafeterias. So those are things that are going to be challenges that we're going to need to work through to figure out what we can offer. But I think if the cup is half full and we're having a positive mindset, I think I'm pleased to let you all know that I think we're going to try to do this, and there'll be more information forthcoming in the next week or week and a half. So.
Yeah, thank you, Doug. I don't mean to sound too pessimistic or negative. We are certainly, we are going to try to make something work. And, honestly, we're confident that we can find something to work. But there certainly are a lot of challenges to overcome right now.
Yeah, I do got to say that a couple of things. I think Wakefield Youth Soccer has done a fabulous job. Being a grandfather and being told that only one parent or grandparent can come and watch the skills and drills, and I was not on the list. And I respected it, and I respect them for doing that. But that to me was a little bit heartbreaking, but that's okay. I've got many years to look at that. So they have done a great job, and Dan, you've done a great job managing them. As far as basketball is concerned, I fouled out of a lot of games, so maybe this might have helped me stay on there longer. So I'd be interested to see what the new rules were. Ricky Boyages would have certainly scored more points had had they just been in a zone all the time in those days. But so that's all great. And I got to say that your cross country team, I've seen them running around town, and I will tell you, saw them running the other day, and I think there were probably 10 kids running. And 10 of them had on masks. 9 of them had them covering completely. One of them was probably taking a breath, it looked like to me. So they've done a great job. If our people walking around the lake were doing had the same percentage, would be a lot better. So if the kids can do it, certainly we can do it. And that's a great segue maybe for Jen to talk about some of our media campaign that we're looking at and some Thanksgiving tips. So Jen, why don't you take it away?
Sure. So Ian, if you wouldn't mind pulling up that PDF file. So we've heard from everybody who's spoken really that we need to get back to basics. You know, it's things we've likely heard before, but maybe the impact has lessened over time. So that's the goal with what we're calling the W's campaign. Steve likes to say it's all about the W, meaning Wakefield. So we're going to tack on a few to that. Wash your hands, wear a mask, and watch your distance. So I'll run through some of the traditional media we'll be using. If you went to town meeting, you would have seen these large posters here. They now have made their permanent homes in the downtown kiosks. If you go to the next page, they'll be complemented by an insert in the Civic Center sign once the food pantry's auction is over. We do have a small amount of airtime on the digital billboard on I-95, so we can utilize that. And then we'll need to be in front of you, Ann, and your council at your next meeting to request a banner across Main Street, as the council needs to formally approve that. And these, of course, can be supplemented with social and web-based messages. So if you flip to the next one, this is where our partnership with the Chamber of Commerce really shines. They're really great at thinking of new ways to engage residents and businesses. And the Sidewalk Saturdays that they're doing is one example. So this is a draft of a window cling. It would be the plastic material that kind of holds up with static. It's not the permanent adhesive, and you could put it on maybe a rear window of a vehicle or maybe the front glass door of a business. And the chamber is brainstorming ways to create an interactive component to this. So maybe you snap your photo in front of a business that has one of these on the door to enter into a raffle. Maybe if your car is spotted with one of these, you get a gift certificate. So it's not just a way to show that you're supporting these, you know, back to basics measures, but it adds an interactive component as well. So that's still in the works, but they're finishing brainstorming that. In addition, I know I've personally received a couple of text messages, voicemail messages. I got one from the commissioner of the Massachusetts Department of Public Health. So the state is sending out messaging. And even as I commute through surrounding towns, they're all starting to put up LED signs with, again, those back to basics, wear your mask, watch your distance type messages. If we go to the Thanksgiving tips, I'll run through that quick, and I'll put in the chat how you can look at it if you want to. This is on the website homepage. It's got a little image you can click on. And really, these are just tips and ideas that have come from the CDC and the Mass Department of Public Health. So on the top are just some lower risk ways that you can maybe switch up your Thanksgiving this year. One is to host a smaller dinner with just the members of your household. And you could, you know, try something new, maybe try a new recipe. My daughter wants to try and make an apple pie for the first time. And if it doesn't come out, it's okay, because it's just us. If you're not Zoomed out, you can gather with extended family, and you don't have to have the iPad up while everybody's chewing. You can just set aside a half hour to, you know, just reconnect. Or maybe spend some time doing something that you haven't had the time to do with the people that you live with. Do something fun, have a game night, rent a movie that you all love, that kind of thing. If you are going to go out and mingle with those who are not in your household, there are some tips to help you do it responsibly. One, as the other folks I've mentioned here, wear a mask, even inside. Don't share food and drinks. And one tip I've seen is that you have the host actually serve the food instead of it family style on the table. Open up windows and doors. Hopefully it'll be a nice day to improve ventilation. This will be a hard one, but it's suggested that you wave or you give verbal greetings instead of hugs. Do be cognizant of the folks who might be at higher risk, and make sure you're taking precautions when you're around them. And then try to keep your visits short. Maybe you get together just for dessert instead of the whole day, just because you know, keeping the visits short helps, you know, it poses less risk. And then finally, if you are going to travel, there are restrictions. If you can click that link to see the Massachusetts travel orders. So if you are going to a state that is in a higher risk designation, there are additional precautions you need to take. Happy Thanksgiving.
Excellent, thank you. One thing that our family is doing, and we have always had a traditional big Thanksgiving that has been hosted by my 82-year-old mother. We had a little wrestling match and took that away from her, further ensuring my place in her will, I'm sure. But we're going to have an outdoor appetizers with some hot soup, and people can be outdoors, and then people will go back to their homes. So there are ways to get together and, you know, in the fresh air and keep people 6 feet apart and wear the masks. So we certainly want to do that. I certainly would be remiss if I didn't continue to give a huge shout out to our public health workers. That whole department takes every call, every email, every text, particularly our nurses, both at the town hall and at the school department. Boy, are they doing unbelievable jobs around the clock contact tracing. And our whole staff has been great, and I do really appreciate all that they're doing. Testing is still available at the the Square One Mall in Saugus that a lot of people have gone to and gone there. We will be also trying to get some testing in Wakefield that we can also do. We'll be trying to work on that. But I am very impressed that even the last couple of weeks we had was over 3,000 people in Wakefield. 3,000 tests, might not be 3,000 people, but 3,000 tests. So we've shown a pretty good ability and a pretty good awareness to get tested. So all I can say is it's all about the W's. This is still the best defense that we have over the next few months. So please wear a mask when you're going in to visit your family, when you're not eating, when you're walking around the lake. If you're cleaning the leaves in the gutter, and thank you very much for doing that, you are in a public place, still wear a mask. So as long as you keep doing that, we'll do what we can. A good question I just got through the chat is, will testing be available in January right after New Year with schools returning? I don't have an answer to that yet, Shian, but we will certainly look into that. Testing will be available somewhere. I'd like to get that in Wakefield if we can. But that's a great question, and we'll be working on that as we go. Does anybody have any else to add other than stay safe and enjoy the weekend? Seeing none, great job. Thank you, everybody, very much. Thank you, Wakefield. Thank you.